Why don't we talk a little bit about the litigation, because I know that folks may be a little bit squeamish about filing lawsuits, and you know, for the doctors out there, you know, our goal is not to sue doctors. We don't think doctors are to blame here, and we haven't sued one doctor yet in this litigation all the years we've been doing the hip implant cases. In fact, we believe that doctors were not aware of the clinical safety issues with these devices because the bioengineers, the biosafety engineers for the companies sold the doctors a bill of goods. They said this is a better product. You can use it in younger patients, you can use it in more active patients, and what they were doing was increasing by several times the ability to reach more and more and more patients. They were telling doctors these things don't have to be reserved for the 70 and 80 and 90-year-olds, which was historically the case. You can put them in 60-year-olds and 50-year-olds and 40 and 30 and 20-year-olds. We have a 21-year-old client, a 24-year-old client, and a 29-year-old client. So unfortunately, those people are much more active and typically and create more of a burden on the device. And it may well be that marketing these things to a broader and broader community of people was not you know, sound business. It may be that the manufacturers had a responsibility to have told physicians that, you know, we're not sure what the long-term consequences may be in people who are more active and younger, more athletic. And in fact, this claim that they made in their marketing materials that these things would wear less, that is, they would create less metal debris and would be more stable in a younger, healthier, more active population were not true. They simply didn't have evidence to back that up. And in fact, we know from at least one of the cases we work on that they had evidence to the contrary, and that people who are this active and all were having a lot of metallic debris at various points within these metal implants. And so it begs the question of whether or not surgeons should have been told early on that moving these devices into a younger and younger population of patients might not have been borne out by the testing and the science that either was done or should have been done.
Right. And the other thing is their literature will often talk about, you know, having less than a 1% revision rate after 5 years. We're going to see some of what Stryker Rejuvenate specifically promised with this product. But normally what we tend to find out is after the recall, we see 15, 20% or even more have this metallosis complication and need to have a revision. So we'll see as time plays out, but we're certain we're probably going to see more and more folks having revisions as a result of this bad product.
And speaking of that, you know, we represent a number of Stryker folks right now. We're getting more calls every day. A lot of you will be getting letters soon. What are we doing? We have, so far, we've talked to you a little in the past about multi-district litigation. Daniel and I are on some committees for the DePuy case, 2 of the DePuy cases that oversee nationally the coordinated multi-district litigation for the DePuy, ASR, and Pinnacle cases. There are other cases for Wright Medical products, Smith & Nephew products, and Biomet products that Daniel and I work on, a fewer number of cases, but we're also willing to talk to you about those. If you've had an implant put in the last 3 or 4 years especially, and you're not sure what it is, we can help you find that out. If you've gotten the letter from the doctor, you've gotten a letter from Stryker, then probably you know that you have a Stryker Rejuvenate. You may know if you've gotten a little card from the doctor whether or not you've gotten perhaps a recalled product from DePuy or from Smith & Nephew or one of these other companies. But if you don't know, we'll be happy to talk to you about that and help you figure that out and see if we can help you. But what we're doing is we're filing lawsuits in various jurisdictions with Stryker that we think ultimately will be put into one of these MDLs that are referred to, this multi-district litigation. Hasn't happened yet. We believe there are more than 20,000 of those recalled stems put in, and that many thousands will have to come out. So we think the chances are good that the judicial panel on multi-district litigation will see fit to consolidate these cases before some federal judge. And in that event, your case would not be part of a class action per se, but we would file it in a district court in Pensacola or Mississippi or Alabama, wherever you live, and then ultimately would be transferred to this MDL, and Daniel and I, in all probability, would be appointed to help manage that litigation for the plaintiff's side. It is possible that the cases would go to New Jersey because there is a judge up there who is handling a bunch of these cases because Stryker is located there, and you can file the case either where you live or where the cause of action accrued or the defendant's principal place of business is. So we're not 100% sure on the Stryker claims where your case will be filed yet, but you can rest assured it'll be handled as an individual case, even if it's consolidated with others, and we would work it up individually for trial or settlement. Daniel, anything to add to that?
Yeah, the only thing I'll add is if you've had any surgeon tell you that you have a recalled product, there are a lot of pitfalls that you can fall into with this kind of a case. I think as soon as you find out that you've even have a recalled product, let alone have any problems with it, but as soon as you find out that you have a recalled product, you should call an attorney, because there's several pitfalls that you can fall into this, and you should ask about your rights given the recall.